Hi, today's topic is how to work efficiently in the hospital. Hospital is most complex environment with challenges like 3 shifts, dynamic disease therapies and vast medical knowledge. We are dealing with human health. We have to have an error-free environment. It's found that many of the developed as well as developing countries do have high incidence of medical errors. The root cause of the medical errors is lack of knowledge, lack of adequate resources, lack of skills, and lack of quality practices. Efficiency would be most critical aspect of best possible patient care. To achieve clinical excellence, learning from failures and successes should not be stopped. Only qualification and knowledge is not important. Qualified people should have good behavior, attributes, values, traits, and motives. Leading hospitals have initiated evaluating their employees on the superior performance criteria, which is directly related to the behavior, values, attitudes, traits, and motives. The organization can teach skills and enhance the knowledge, but to develop an employee as a leader is not easy. Qualification and knowledge alone are no longer sufficient criteria to select hospitals' skill set. Competencies analyzed from real-life situations, know-how and experience rather than level of qualification and seniority is becoming a popular method to select and promote employees. The successful leaders have capacity to solve problems. Soft skills like leadership, teamwork, and desire to learn new things is becoming a new criteria. Efficiency is gold standard criteria of successful healthcare professional. Whether it's nurse, doctor, housekeeping staff, administrator, human resource department head, or CEO, competency of the relevant job is most critical aspect of human healthcare. Competencies are tested with references to real situations. Patients and relatives are bold enough to give feedback about the services offered by the hospital organization. The utilization of these feedbacks would score the competencies of various personnel who are working in the hospital. Also, the internal feedback explore the ranking of various employees' capability to resolve problems. There was scarcity of communication methods to find skilled and experienced staff. In 21st century, human resources recruitment management consultants are available with database of aspiring candidates. Through these consultancies, it's very easy to find out the qualified and experienced staff. But to identify the job relevant competency is still a challenge. Leading healthcare organizations have developed their own system to identify the competency of staff. Background verification, written exams, detailed interviews, and interactive sessions explores the leadership competency. As leading hospitals believe that skilled and competent staff can help organization grow faster at desired level. When we think of competency, it's no longer only knowledge and qualification. The most critical part beyond knowledge and qualification is the skill of employee and capacity to resolve problems which arise due to uncertainties. Many qualified and knowledgeable healthcare professional employees share our problems with seniors and expects that they should help them and guide to resolve their own problems. Now, as the revolution in the management of people is happening, the organizations expect that each one who is qualified should be able to resolve their problems on their own. Result-oriented practices are expected. This is traditional approach towards management of human resources. Recruitment and selection usually happen based on superficial criteria like qualification, appearance, superficial knowledge, and attitude. Even soft skills like attitude is not being measured the way it has to be. The assessment of personality and attitude is subjective. The job description is given based on hierarchy. For example, a postgraduate nurse in cardiac services lands up in reporting to a matron who is neither postgraduate nor aware of complex cardiac procedures. The development of the employees is targeted to aim promotions. Criteria like self-development based on skills like leadership, teamwork, project management, result-oriented analysis, and expansion of the knowledge shall be used. Appraisals shall be specific based on productivity, results, and skill improvement. The evolved approach to manage the human resources in hospital needs to be studied thoroughly by the freshers and seniors who want to progress faster. The recruitment and selection happen based on demonstrated competencies. The interview actually happens at different phases. First phase could be general assessment of the employee. Second phase could be demonstration of the skills you achieved in your previous organization. Different scenarios are given to assess the behavioral skills, values, and attitude. The job description is shared based on the intention of the organization. In fact, job description is ready before the interview. And the selection process happens based on compatibility of the new employee who can fulfill the expectations through the job description. The development and training are based on the analysis. The organization's intention and the concerned employee's incompetency are analyzed. Employee-specific training and development plan is customized. Appraisals happen based on complete performance details. The performance analysis is done based on overall experience about the employee's function. Direct observation, feedback from patients, document review, value addition training certifications, demonstrable skill improvement, and internal feedbacks from the colleagues are newer methods to assess competency. Every organization can have their own competency assessment framework. For example, organization can gauge the performance by these 8 attributes: analytical skills and problem solving skills, communication skills, capability to deliver quality and result, seriousness on learning and development at own level, the prioritizing and organizing skills, intensity of resilience, feedback how the employee worked with others as a team member or as a team leader. In this example, these 8 points are being considered to assess the employee's progress. Based on the score, the concerned employee will get promotion or even demotion in case of bad score. The professional skill has 2 facets. One facet is your qualification, skill, and experience. The other facet is approach towards clinical excellence. It also demands leadership. To hone leadership skills, extracurricular activities like achieving communication skills, being disciplined in lifestyle, being healthy, and being confident has to be focused upon. The most important aspect of gaining confidence is having clear basic concept at our workplace. Lack of knowledge is lack of confidence. When our knowledge and skills are appreciated, our confidence keep getting uplifted. We have to work hard on the critical management aspects of the hospital. Ability to communicate in meetings, ability to understand, and ability to express ourselves so that our team members can understand the right intent of execution. To communicate technical or specialized information is difficult but important skill. We should have capacity to present issues to team members or top management. To align with quality management system, which would require drafting skills so that we can create protocols, standard operating procedures, or instructions. While being continuous member of meetings, we automatically should learn how to chair meetings. The confidence and appreciation at workplace would only come when we'll start improving on our own personal competencies. It includes self-management, being confident always, being positive, being self-motivated and inspired. Our every thought or action has to have an ethical background or an ethical attitude. Hard work is the only solution to gain knowledge, technical expertise, methodical approach, and experience. If we won on the front of personal competency and technical competency, this would boost the confidence in our actions. To achieve the respectable social competency needs lot of efforts. We can develop skills to motivate team, supreme communication skills, conflict mediation, and cooperation. Implementation competencies require data analysis and planning. Knowledge about subjects like project management, determining the priorities, planning, achieve result-oriented milestones, driving the goals, environmental awareness, political management, and risk readiness is necessary. If you read and learn strategy and tactical thinking, then nobody can stop you from the progress. If you are a senior employee in the hospital where incompetency would never be digested or justified, every senior employee should have sharp skills like leadership, strategic vision, achieving results, excellent communication, manage relations, manage human resources, manage general management, and train the team members. Many employees have qualification, experience, and general leadership skills. Those who have special leadership skills like innovation, creativity, flexibility, change management readiness, relationship building, and future orientation are true leaders. Visionaries are real hard workers on all these fronts of work, health, and social maturity. Competencies can be classified as personal competency, social competency, professional competency, strategic competency, and functional competency. Personal competency is working on ethical values, motivation, and attitude. Social competency is working on cooperative behavior, listening skills, adaptability, respectful towards culture of an organization, and politeness. Professional competency is working on new theories, practical aspect of concepts, skill enhancement, and knowledge about the relevant rules of the organization. Strategic competency is knowledge of and ability to manage the organization's business goals as well as high-level and long-term issues. The last but not least, the functional competencies are the ability to function with an intention to create an error-free environment, to use others' competencies in your work zone, and desire to have an exemplary performance. To simplify, futuristic model of competency could be working on skills, knowledge, experience, contacts, and values. We should have current best skills. We should have updated knowledge. We should accept our past mistakes and should have attitude to learn from failures and successes. We should influence the social circle when in need. We should have skill to utilize this social strength of ours. The first and foremost value we should have is we should follow right path responsibly. Conventional interviews are going to be replaced by futuristic interviews. The futuristic interviews will include motivation, service orientation, education, communication skills, cooperative ability, language skills, result-oriented activities, respecting cultural challenges, analytical ability, willingness to change for better outcome, and personal maturity. Leaders are fair while people management. Leaders encourage personal as well as team development. Leaders should be able to understand the exact pathway to achieve high performance at work. Leaders have the ability to align with organization's mission, vision, and quality goals. Leaders manage team members through continual monitoring, training, and motivation tactics. What are the characteristics of efficient work? If you want to be efficient at workplace, this kind of pathway can help. First, we should find the gap between the best skills and our existing skills. We should have capability to plan how to fulfill this gap utilizing existing resources. We should keep evaluating ourselves how far we can come to achieve predetermined targets. We should be well versed with all the pathways of competency improvement. We should never bypass the ethical practices. If we are either a team leader or a team member, we should always believe on teamwork. We have to be healthy so that we can focus on our targets. We should never compromise on vigorous training on ourselves and our team. Whatever we do at workplace, before doing it, we have to be serious on revising the content to avoid mistakes. If we accept our mistake, then only we can think of appropriate corrective and preventive actions. Whatever we do should have to have a reference background of guidelines which are developed based on standards for better outcome. Whatever we do, we should ensure on-time recording appropriately. Whatever we think, do, or communicate, it has to have a background awareness of quality. Without discipline in our life, we cannot be successful. Continual expansion of knowledge and skill is essential. You are doing these all things justify that you are on the path to become a best leader of your own world of quality. To simplify, whatever we do, we should have to refer best practices developed based on standards. We have to read and understand all these standards. Once we develop and create protocols, thorough training shall be ensured before implementing the protocol. Anytime before initiating or executing the protocol, you ought to revise it. We have to record appropriately whatever we do. Not documented means not done. In spite of an effort to have an error-free environment, mistakes may happen. We should take appropriate corrective and preventive actions for all the mistakes to avoid future repeats. We have to take care of upgradation of knowledge and skills for ourselves as well as our team members.
Hospitals are looking for support to achieve the clinical excellence. One of the resolution is to go for accreditations, to set the standards, to follow some standards. The second step, which will get close to the clinical excellence, is hospital staff training. Gap is to train the staff or to develop such trainings which will focus on patient satisfaction and revenue growth. So such trainings which will develop the quality thinking in the hospital staff, and by that I feel the patient satisfaction if increases, then obviously it will impact on revenue. And we also certify all the staff. We also give them the course material, and at the same time we have affiliation with United States Higher Learning Board for Education. We'll be giving you the international certificate, which can be a very high motivating factor. We are approaching towards clinical excellence, and we can progress together.